Thank you so much. Welcome to our presentation tonight, everybody. I hope you will enjoy it and be well informed and all things to do with patching. I just remembered that I'm actually doing the presentation today and I haven't got it ready yet. So there we go. It's all fun and fantastic. Anywho, we are speaking to you about all things Lifewave patching, and I just want to tell you that you have made the best decision possible to jump on this call and to learn all about it. I'm Dr. Mich Seagreen. I am based in Durban, South Africa. I was introduced to the product in December 2023. The life-changing experiences that I've had, that my family's had, that my patients have had are remarkable. And it has made me, seeing blood test results show change, seeing pain relief, you know, that I didn't think would relieve. It is remarkable and life-changing on so many levels. And I'm so excited to be able to present with you tonight. Linda, would you like to just let us
introduce myself?
And Linda will be doing the product.
I'm Linda de Lange. I'm from South Africa. I live in northern KZN. And as you see, I'm a nursing sister and run an old age home, which we've got a lot of very exciting results to share with you. But I'll do that when we do our testimonies a bit later. But just welcome to everybody on the call. This is the most incredible product. Of course, we're all very skeptical in the beginning, and I said to Mitch, 2 months, I will try this and not tell us all about it. But once you see the life-changing experiences people are having, you just got to tell everybody about it. And my vision has mainly been to help people. I've always not fancied the idea of multi-level marketing, which I'm slowly getting my head around it. But so I've done a lot of patching on elderly folk, and in fact, anybody that I see who is experiencing pain, and just seen the most incredible results. Okay, can we start with the slides?
There we go.
Mitch, I don't have the slides on my screen.
It's because you're on your phone, I guess. Can you see them on your phone?
No, they don't. No, I've still got. Oh, sorry, everybody. This is my first time. I've just got the participants on my screen.
Swipe left, I think, or right on your screen. Does that do anything?
No. Sorry, everybody.
I'm happy to take over if you want, Linda, but let's see if you can find it quickly. But if you want help, I can see the pictures.
Okay. Oh, there you are. I got it.
Okay, good.
Sorry, everybody. The first thing we always ask is, have you been patched yet? As you see on that diagram, the little white plaster with a white center is the patch the miracle patch that we all talk about. Next one.
Yeah, I'm trying. Oh my goodness, look how rusty we are. And I did this with Caroline the other day and it was fine.
So if you have a keyboard, press the backspace, and the one that does the next line.
I think my computer's frozen.
Okay, that could be it. Because what happened for me is I couldn't find my mouse on the screen because it got hidden behind
There
the
we go.
You got it.
It's working.
Fantastic.
Yeah.
Oh, well, we'll get going. We can't talk about these wonderful little patches until we acknowledge David Schmidt, the CEO and inventor of X39. On this slide, it says he has over 130 patents, but we know it's as much as 180. He's a scientist and inventor. He's not a medical doctor, although he has received 2 doctorates. Which he doesn't. He's very humble, doesn't use doctor as a title. He specializes in age reversing. In 2008, David focused his attention on stem cell research. This took a 10-year period and $4.5 million US to bring to market. Patents. We all know the extent that one has to go through to acquire a patent. It's got to be proven on many, many studies, and there can't be anybody else who has anything similar. So we are very proud to say that this patent still has 15 years. So there is nobody that would be able to replicate what David has done. And this patent is the embodiment as a result of elevating copper peptides, including activation of stem cells, improvements in energy, and elevation of antioxidants. Why X39 stem cell activation patches? The fewer stem cells you have, the faster you age and the slower you heal. Hundreds of millions of people are experiencing symptoms of aging. And those of you who have reached the age of 60, like myself, we realize that healing and wrinkly face and all that sort of thing becomes a reality. And at the age of 30, half of your stem cells are still active, and over 60, most of them are not active anymore. How does X39 work? It's a proprietary form of phototherapy. And phototherapy, another word for that is light therapy. It is a patented nanocrystal technology. It reflects light to activate. So it's non-transdermal, which means your body's light is reflected off the center of that patch and reflected back into the body. This increases the copper peptides, and then activates those dormant stem cells. So no drugs, chemicals, or stimulants pass from that patch through the skin, which means it's non-transdermal. It's non-invasive, so it cannot interfere with anything, with other medication, because there is nothing other than light that is reflected back into the body. Benefits of X39: increased strength, reduced inflammation. We often see that with people with painful joints. After a couple of days, really experience reduced inflammation. Increased stamina. I always say that I've cut 20 minutes off my park walk after using the patches, and that's not doing any exercise during the week. So I can really vouch for that. Increased energy and vitality, mental clarity. I don't know if any of you have experienced what we call brain fog, where you just don't feel you have a clear mind, restored muscle or skeletal conditions, improved sleep. That's also another big thing that we often see initially within the first day or two, that the sleep is improved. Also, improved skin appearance. And we've seen that with quite a few of our brand partners, how they're looking younger and younger every week. We this is a topography map of a 77-year-old woman placed the X39 on the back of the neck. In session 1, you can see that reddened area there, lots of brain inflammation. And in session 2, the patch was applied. That's 3 weeks on X39. You can see the drastic reduction in inflammation. And then in session 3, after 6 weeks, we can see how there's normal brain activity there, the marked improvement in 6 weeks. X39 long-term results per case studies of this is it. First few days, there's 4,000, sorry, everybody, I'm doing this on my cell phone, so I'm battling to read here. Mitch, won't you just do that slide for me, please?
No worries. So 4,000 genes begin to reset. Am I muted still? Oh, there we go.
No, you're not. But
4,000 genes begin to reset as per case study on thisitifo.com. And the way I like to look at it is a typewriter, old-fashioned typewriter. You know, after time that ribbon gets a bit messed up. So what the stem cells do is they come in and they give you a new sort of typewriter sheet. Within 6 weeks, the brain becomes balanced, and that is as per that topography map that you just saw. And within 3 months, your collagen is increased. So collagen is basically the key that keeps your body together. It forms your blood vessel walls. It's also in your skin. Everyone knows that if you increase your collagen, you have fewer wrinkles. So the stem cells really help to make you look younger because of collagen. But what you see is basically on the surface. So that collagen is also working deep down in your organs. And then within 6 months, the heart reverses in age. And this is as per case study. And this can all be seen on thisitifo.com. David Schmidt says it's not anti-aging, it's age reversing.
Thank you, Mitch. Okay. How to wear the X39, wear your patch 12 hours on and 12 hours off and allow that 12 hours for repair and rejuvenate. And after those 12 hours, we often encourage people to just place them on your spouse or an animal because they still do have life in them. And if we're trying to treat a specific condition and we're needing healing to take place, that's the correct way and the quickest way to see it, by wearing it 12 hours on and 12 hours off. Then throw the patch away, and as I mentioned, you can use it on your spouse, your kids, or an animal. Then put a new patch on and repeat this every 24 hours. You can wear more than one patch, not more than one X39 is necessary. For example, we have the Eon patch, which is an anti-inflammatory, and quite a few others. You can wear them simultaneously. Drink lots of water. We found that it's really important to put an electrolyte into the water so that this helps the cells rehydrate and repair quicker. So X39 is so sophisticated, yet simple to explain. Testimonies of X39 are life-changing and emotional. the best thing about X39 is it absolutely works. So Mitch, I don't know if I can just give a couple of testimonies before we move on to the floor.
Yes, please, go ahead.
Working in an old age home, you can imagine there's lots of falls, and we found specifically in one lady who often falls, she's a type 1 diabetic, she's almost blind, and I don't know how, but she manages to fall and hit her ribs on the basin, which often cause her a fracture. And Mitch and I went in, put a Eon on the actual site of pain, and an ice wave on either back of her elbow. And before we even left the room, she had complete pain relief. And we've done this twice, so it's not as if it's something that it's once, and it's every time we use it on her, we see good results. Only pain when she coughs, which is incredible. Then also the seen in my colleague, her husband has had a kidney out for cancer, and his remaining kidney was functioning at 34%. And he is now, his latest bloods were up to 65%, which just means he's gone from pre-renal failure to actually having normal kidney function. So this has been the most incredible progress for him. Also, last one, sorry, I could talk all night. One of my board members, he suffered cancer of the larynx from very bad reflux, and literally like the worst laryngitis. He said he used to have to draw breath like he was about to blow the bagpipes. And in the morning, he dreaded getting up, trying to initiate speech. And this last week, he said he was almost able to shout at one of his employees, which he's never been able to be heard by them before. And then said to me, oh, he had a calcaneal spur and had terrible pain. So I said to him, have you tried a patch on the back of your heel? He phoned me from Gateway Shopping Centre to say that he's walked the whole day without any pain. So those are just a couple of my testimonies from the use of X39 and sometimes Eon.
Thank you, Linda. We'd like to ask if anyone would like to share their testimonies. If you would like to, just unmute yourself or pop your hand up. Otherwise, I might just call on someone.
Mitch, you've got a lot to share about your mom. That's incredible.
I do, but I think it's sometimes nice to hear others as well. Avril, would you like to share?
Yes, I'll do that, Mich.
Thank you.
I've got a new, relatively new something that has happened. I've always had sciatica, so I've always had lower back problems and burning in my leg, and then, well, not in my leg, in both my legs. So I've never been able to really walk because the pains are just bad. At night, I couldn't sleep because I would have to get up at least 4 to 6 times a night just to get up so I can move to get rid of that pain. And now I actually have started doing the park run, but I'm not running, I'm walking. I've done it 3 times already, and I haven't got any of that pain in my legs. The numbness in my fingers not there anymore. Yes, so that's a nice.
Wonderful.
Yes, so
Thank
I'm
you
excited about that.
Wonderful.
Yes.
Anyone else? Kirsten, are you able to chat today?
Yes, I am. Sorry. Yes, I am. So I'm actually busy typing a message. I'll talk about the children. I'm busy replying on the WhatsApp group where someone asked whether it is okay to patch a healthy young child who doesn't really have anything wrong with them. And I'm just writing my reply saying yes. So we patch our children, 10, 7, 3, and 1 are their ages. The 10 and 7-year-olds are in a school, and it's quite a large school. So if there are bugs that go around, everyone generally gets it, or usually our kids do, and they do so much sport, actually all the sport that's offered at the school. And for example, today started off 6 o'clock swimming, and then school. After school, we had cricket. After cricket, we had rugby, and we were done at 5 o'clock this evening. Now, it's the entire spectrum of waking up freezing, getting into an ice cold pool, the day becoming so hot here and humid and they play outside in break times, and then to carry on sport in the sun, and then it actually becomes quite nippy and cool and you're sweating. So that's how their day went. So we've decided and made our list on what days that 10-year-old needs to patch now, because we just like to take precautions and just to ensure he doesn't get sick. So yeah, we patch our kids healthy, and luckily our first December and January holidays were spent where no one got any bug of any sort. So we're very happy.
Brilliant, thank you.
Excellent.
And I know that you also have had the experience of your 7-year-old, I think, was on Ritalin at the beginning of last year.
Yeah. Yes, so he was on Ritalin for 4 months, and we did not enjoy the side effects of that, and did try several other meds as well to try and see if there's anything that could work, have less stimulants and so on. And right now we are on a very low dose of no stimulant med, and I'm sure that we could possibly, hopefully, leave it very soon.
Brilliant. Thank you for sharing.
So something that I'm actually adding onto my message is that I'm convinced the kids sleep deeper when they sleep. We haven't actually put devices on them to check, but they in general way less moany the next day. They would ask for food, but they'll go and get an apple or a banana, and that's when we patch them. They choose those things, and when we don't, it's like it doesn't matter what you drive past. Mom, we haven't had McDonald's in so long. Can we have McDonald's? Or like their choices are just so different when they don't patch. So I haven't labeled it, but I'm just thinking back of like our times where they've been patching for a whole week because we're trying to avoid something, and they are just different. So yeah, there's a new one.
Well, yeah.
Excellent.
Hopefully it makes us all a bit healthier in terms of our eating choices as well.
Yes.
It would be nice. It would be nice. Okay. I've got so many stories. I wouldn't know which one to share, but most of you have heard that I've had eczema most of my life. When I started patching consistently and well, that eczema cleared completely for the first time since I was 18 months old. So that is my huge story. And I'm learning that eczema is like an autoimmune condition, actually. So I understand now that I've investigated all of that, why it took maybe 6 months to get a result, because with your autoimmunes and your call them big diseases, there's a lot going on. And so I would urge everyone to patch consistently and for as long as it takes. And then when it comes to my family, one of my sisters has a kid who has got juvenile rheumatoid arthritis. And the other day she phoned me and she'd put an Eon on my niece's shoulder, and that was really sore and stopping her from going to sleep, and she went to sleep straight away. So that was a very big win for me. So I'm waiting excitedly to see where that journey is going to take us. The other thing is, with my mom has had a history of very severe stomach issues where she wasn't able to eat normally. She couldn't eat a slice of toast. She couldn't eat a pasta. She couldn't eat the food that we sort of normally eat. She would eat meat and veg, and that's about it, and very limited veg at that. Until she started patching, and 6 weeks into patching, she was able to eat pasta. She was invited for a meal and she couldn't turn them down. And she expected to be in severe pain the next day, and she was not. And that was a huge testimony to me, because, and then she came to visit me and we ate toast together, which I don't think I've ever had toast with my mom in my life before. So that was quite exciting. So now she can actually enjoy meals again and not just eat for fuel. Right, I think hopefully that's
amazing.
it. So Linda, the next slide will be yours again. There we go.
Next one.
Everything down. That's taking my. There we go.
Okay. After hearing all that, we have an incredible website where you can get so much information. And my advice to those of you who are new with Lifewave, for me, the best thing ever is to be empowered with knowledge, so that when you are approaching people, you've got a good understanding of how the product works. The more confident you are, the better for the people you're speaking to. It's very difficult to go and say, oh, have you heard about a stem cell patch? And in fact, you don't even know what it is. So go to thisisit.info.com and refer anybody who'd like to know more about the patches. It has a host of information that I'm sure will be beneficial to every person who's interested in the product.
Thank you, Linda. So today I get to share the company, about the company and the business side of Lifewave. This is the side that I was quite uncomfortable with in the beginning, but I understand now how important it is for this product to be shared by word of mouth, because it is truly remarkable, and the stories are so exciting that, you know what, you're not going to walk into a chemist and pick up X39 off the shelf and know what it does. But having listened to us talk, and I speak to people every single day, and it doesn't matter who it is, I just blurt out about stem cells and the patches and what it can do for you, because I am converted, especially after seeing those blood test results. So now that I'm so invested in the product, I need to know more about the business. And as you can see here, Lifewave is a 20-year-old company. In 2021, there was a huge explosion in the income of the total company. And last year, we did over 600 million. And that is due to the X39 product being released 4 years ago. That caused a great explosion. And you cannot get that kind of explosion with a product that doesn't work. And that just shows me how well X39 works. The company is open in over 80 countries now. And if you are going to go into the business side of it, it's very comforting to know that there is no other company that has produced a patch like Lifewave's X39 or the other products. And because there's a patent, there's another 15, 16 years that there will not be another Me Too company. So that is a huge security blanket. This screen just shows that Lifewave is now the first highest ranked income generating work from home based company in the world. And it took over the number one spot during our growth in over the last year. So I'd like to ask yourself, what's most important to you? Is it your family? Is it time to spend with your family? Is it freedom to travel? Is it security? Is it less debt? Is it better health? For me, initially, it was about how much more I could help my patients. It was about those patients that I could help 80%, but there was that 20% that I just couldn't touch. And I was so excited because I knew I could help so many people's lives with various diseases, ailments, injuries, and issues that as a chiropractor, I can treat, yes, I can manage, yes, and I can help most people up to 100%, but there are those 20%, and that was me. But as I've gone through this journey, and as I've been exposed to this company, I've seen the travel that people are doing on the business side. I've seen how people close to me have less debt and less worry, and just that concern around how they're going to pay their bills at the end of the month has reversed. Loans paid off. So it is remarkable what this business is doing for people's lives on a wealth level as well as a health level. So if you're wanting to do the business, it's really is simple. And what you need to do is you sign up with the person that invited you in, and then you speak to 4 people, 4 friends, 4 family members. You join 2 on the left and 2 on the right. And that is how you become a manager. And then what you do is you teach them how to be managers. And that's how you go. It's as simple as that. You will join on the left or the right of somebody else, your person who sponsored you, and they will end up becoming part of that your team on that side. So for example, I joined under Dr. Kathy Mercer on her left side, and everyone who's on my left, including Linda, we form a team on our left, and we grow that team. And on the other side, you grow that team as well, and then you can start earning $50 in cycle bonuses from a binary. And that is capped at $25,000 a week. So that is the potential just from creating your teams on this binary system. Obviously, when you introduce someone, you also do earn a commission, but that's a very limited thing. This working as a team, that is what's going to generate your income on a weekly basis. And it's quite exciting because as you help your team grow, you also get paid. So, for example, Linda is on my first level, and every time she potentially earns $1,000, I would potentially earn $250, and that is as a matching bonus. It's not of her money; she gets her full money. It's just a matching bonus. And then Linda introduced Annie, for example, and as Annie earns 1,000, then Linda gets 250, and I get 200. So that's how it works. But if you're coming into this now and you're confused because of what I've said, don't worry, because as I said to someone in my downline earlier today, when it starts happening, you see it and you learn and you grow. So when it comes to the business side of it, you do not need to know how to dot every I, cross every T. It really comes to you and your team and your upline, and everyone is so incredibly helpful to and will help you through this exciting time. So how do you join? Well, David Schmidt basically says that you should try for at least 90 days before you decide whether the product works for you or not. I'd like to remind you, though, that for someone like me, it took me 6 months to get the desired outcome that I wanted. So 3 months may not be enough, but that is a good way to start. Is on the core package at $295 US. You get your 3 sleeves of X39, and that is 3 months supply, and it's a great way to start. And in fact, a lot of the people that are wanting to try the product but not use the business on my download are also joining on there because they want to try out the 3 months, and there's no obligation to do the business if you don't want to. But in all honesty, you'll be so excited about your experiences that you will start talking, and eventually you may start wanting to earn something from the business. If you are wanting to dive into the business side of things, you can start with 6 sleeves of X39 as well. That's the advanced. That's $535. So your 6th sleeve, you're only paying $35 for. So that's a great saving if you can do it that way. And then if you're going to distribute as a pharmacy or in a clinic and patch people for various things, then the premium package would be the option for you. Now, one of the biggest things that you need to remember is that if you are wanting to do the business and you're wanting to be part of that team, in order to benefit from being part of those teams, you need to be active on the system. And that literally just means buying yourself product every single month. 1 sleeve of X39 before you become a manager, or 2 sleeves after you become a manager. And the difference is simple. If you only have the 1 sleeve active, you'll get $100 in cycle bonuses capped. But if you open up and become a manager, you qualify for more. So that is the potential for greater earning if you do keep active with 2 sleeves. Okie dokes. Again, this is at info. That's where you go for the science, for the how it works, for the case studies, for the patent, all of that on this is at info.com. This is at team.com, has been put together by the couple that runs our team. And it is remarkable because anything that you need to know about the business is there. You can spend 5 minutes on there every day and educate yourself on something, or you can spend a lot of time on there. But that is really a good go-to. And there are awesome resources there, including, for example, some people don't like to do this thing online, and they can fill in an actual paper application, which I've used a couple of times. And really the time is now, to decide, do you want better health? Do you want better wealth? Do you want both? It doesn't matter what your why is. I would suggest that anyone should start on X39 because just for yourself, the health benefits are huge. I mean, for me, I started playing tennis 2 years ago. And if I compare myself to my tennis now to then, my stamina, my energy, my strength, my knees better. I had failed knee surgery. I mean, it's been huge for me just on a personal and a physicality level, never mind on an income level. So for me, this is a brilliant journey and I'm loving being on it. And I'm so hoping that that whoever's on this call will join us on the journey, and please go back to the people that invited you, and hopefully they can assist and get you started. I think we can stop recording now, and then we'll ask for any questions to be asked. Anyone have a question?